if you've got your camera on and you've got a question. We think we really want to always offer this as a dialogue. And I realize it's quite a bit of information. So please don't hesitate to pause and ask questions. So big picture, the 2021 General Assembly is well underway. We have not a lot of policy pieces. Our single biggest policy piece is our budget. But let me kind of take you through just a few important updates for you all. So as it relates to laws that are in motion right now or proposed laws, there's kind of, there's two really important ones. Oops, you may have lost my camera, but can you still hear me as it comes back on?
Yes, we can hear you, Jenna.
Okay, so I'll keep talking. I'll pop back in here. So the first one is, you all know last year that we passed the law to unify the early childhood system and move it to.
Oh. You muted yourself, Jenna. You've now muted yourself.
Now.
Yeah, we're good.
And voice. Excellent. There we go. Magic how you're literally, your hands are still and you somehow still muted yourself. It's thanks Zoom. #thanks Zoom. So last year we passed the law that unified the system and said we're going to have a uniform measurement improvement. So all of our Head Start partners, our VPI classrooms, our early childhood special education, any childcare or family day home program that takes subsidy, that we would have a new version of a kind of a statewide measurement and improvement system. In that law, we said we would need at least one practice year, right? That in order, before we kind of rolled that out to everybody, that we want to have at least a year of practice. Then the pandemic happened and we realized that we would probably need more time to practice. So this is just a very small change to that law, but basically we'll say that this upcoming year will be practice, and it'll be practice for all the communities that are part of the PDG. And then we're going to add another year of practice. So it kind of pushes out the point at which this counts. So if you're not able to, we encourage you to be part of PDG this year, and I'll talk a little bit more about that later, so that you can sort of be part of the first practice year. But even if you don't do it this year, know that we will still have another year of practice if this change to the law goes through. And that's coming directly from the governor, and we have not heard any concerns about it at all so far. So just knowing that, we make sure that all of our Head Start partners have at least 2 practice years before this thing becomes real, and it becomes our sort of statewide measurement and improvement system. The second piece is there's a few bills out there that want to provide a little bit more portability and flexibility around background checks. And so we know for our license program that you have to have the comprehensive background checks. And if you get it one place, it can't really transfer to another place. And we know that you're also facing really significant staffing issues right now. And so there's 2 bills that we think are being combined that will allow us to create some portability, right? So if somebody, within that 5-year period goes from one place to the other, you don't have to run the whole background check again. You can just log onto the system and see if they have a live background check. So that will still take some time. That won't happen automatically if and when the law passes, because we have to build the technology to do that. But I think some of you've heard me talking about this before. We have that in Louisiana. It's not wrap back, so it's not where you get an update if somebody gets convicted of a crime, but it does give you all as employers a little bit more flexibility if somebody comes to you with a live background check, that you can check for that rather than having to run the whole thing over again. So those are kind of the 2 bills. And then we have the other big policy work that we have is the budget. And so the governor has really tried to restore many of the investments that came out of our listening sessions with you all and some of your colleagues from Executive Directive 4, really strengthening our investment in preschool, right, both in public settings, as well as in private settings. So through the things like the VCF mixed delivery, which I know some folks have participated in the past, really thinking about how we provide a lot more flexibility to school divisions. So one of the things we talked about this time last year is providing them with more flexibility to define at risk. They can go up on income, they can look at other factors, right? such as like mother's highest level of education, so that it doesn't, we're trying to kind of create a little bit more flexibility locally, because we know that you all prioritize the most low income, and you have the strictest eligibility guidelines, and wanting to kind of give VPI more flexibility, right? So that there's less competition for the slots. We know that more kids would benefit from preschool, and so really making sure that we don't limit that artificially. It also allows us to reallocate dollars. So if your community can serve or has more need, we can suit that. There's a community provider add-on. So if they offer VPI, in a private setting like Head Start, you can get more money per kid than you would typically get for VPI. We're continuing to kind of grow and just serving 3-year-olds, again, with, hopefully that you all are taking sort of the most in need 3-year-olds, and then we're the kind of the group above that. And we're asking for those dollars back for the educator incentives. And so this is through the preschool development grant. We also are increasing the state dollars to basically, as you participate in PDG, your teachers, if you're in a licensed center, not employed by a school division, your teachers get a $1,500 incentive for participating. And I know I think I saw Yesenia on here earlier. I know we have some folks who've been a part of that. We found when we did research with UVA that it's the equivalent of paying somebody about 75 cents more per hour, but it significantly reduces turnover in licensed centers and in family day homes. And so again, realizing that it worked, knowing that already folks are facing so many stressors, trying to get more and more money directly to your teachers is also something that we're trying to kind of get the state on the hook for, largely so that in a few years when the big federal grant goes away, that we have a kind of expectation that the state will continue this program, and that we're not just kind of reliant on this kind of one-time federal grant. So that's the budget. So we've got the kind of the 2 practice years. We've got stuff in play around portability, right? More flexibility with background checks. And then we have a budget package that looks very similar to last year in terms of kind of some enhancements in preschool, and trying to be very thoughtful about making sure that we give the flexibility to communities so that you can maximize both your VPI, your mixed delivery, and your Head Start funding, right? So that we're using every possible slot, that we're not leaving any dollar or any slot on the table. Any questions about the General Assembly update before I go into vaccines? Excellent. And I should say one thing, if any popped in, made me think of it. I think one of the things we're really, really excited about, and we can't wait to get to everybody, is this educator incentive. And so we're really trying to sort of to build that up. We can send you and I'll ask Tundra to share around the UVA research that shows that this makes a big difference. I'll talk a little bit more about it because I just got a question from Michelle on this. So basically what we do, if you are participating in PDG, so we now have 2, and that's the shorthand for, you might have heard of it, PDG or PDG B5. We always have so many letters in government. This was the preschool development grant, birth to 5, that Virginia received one time a few years ago, and then we got the renewal. So it's going to be 4 years in total, about $43 million. And we had to do a strategic plan, which we did, and we had some folks on the phone in our impact work group here, but we are really pushing most of those dollars out to the field in 2 ways. One, we're giving dollars to communities, and I know some of you are participating to come together, to measure to do class observations in your classrooms, to work on coordinating enrollment and strengthening family engagement. And then the second thing is we said, if we have all this money coming out of the feds and everybody keeps talking about quality, well, let's just put the money in the hands of the educators, but let's do it in a way where we can demonstrate that it has a positive impact so that we can convince our legislators to keep doing it, right? That it's not just a kind of a one-time thing. So in the first year, we gave it to teachers in schools, as well as Head Start, as well as childcare. We realized it didn't really have much of an effect on teachers in schools, largely because whether you work for Head Start in the schools or you work at VPI, you generally get paid what kind of the teachers do, and that's much higher than anybody else in the early childhood sector. We did see, if you worked at a licensed center, though, a pretty significant impact. And we measured that, and it was like you're sort of, it lowered by like 20% the turnover rate, right? Again, this is $1,500, which is the equivalent of about 75 cents an hour. But that the places that received it saw fewer of their teachers leave than the places that didn't receive it in this random controlled trial. We also saw that giving it to you more frequently. So in one place we did it in one lump sum, the other place we did 3 $500 payments. Giving it to our teachers more frequently also helped. And I think you probably heard this and probably heard it a lot in the last year. A lot of time you have educators who want to do this work, right? But it's the finances. They've got an immediate kind of bill to pay, or there's a car, they got to fix their car. There's something that kind of comes up, and so providing those dollars more frequently helps. And so we sort of limited to just Head Start and licensed centers, childcare, and family day homes this year. We're even going down from 3 payments down to 6 payments, so still the same amount of money overall, right? But more frequent payments, and measuring the effect of that. And then we have convinced our legislators to sort of invest too. So we now are using federal and state dollars, with the goal being that we would get to a statewide program where year over year you could expect an educator incentive if you're participating in something like the Uniform Measurement and Improvement System. So I know folks have asked, it's a little bit less of a question for Head Start because you often have these higher expectations that come from the feds, but when sort of childcare centers say to us, well, why would I participate and take public dollars and be in the Measurement and Improvement System? Being able to say, well, we can help, your teachers, we can support your teachers is, one kind of incentive. So I'll send to Tandwa. I think UVA did a write-up of the first year and kind of some of the results, and then Tandwa can send that around after it for folks who are interested in that. But if you, again, because you all are publicly funded sites, if you participate in PDG in any of these practice years, your educators who work 30 hours or more a week would be eligible for this, and it's kind of a nice part of PDG. All right, so vaccines. I know we had a great conversation with some of our CAP folks last week about this. So right now, most, if not all, I think communities in the state are getting into or at 1B. As you'll remember, we've kind of had our first, the feds set out a set of recommendations on the vaccine for COVID-19. And then the states had to refine their plans. 1A was mostly healthcare workers, and 1B, we then have a set of individuals that are kind of essential workers in addition to older adults. And some folks can qualify in both areas, but basically we wanted to make it really clear that, so it goes police, fire, and then educators, and it says childcare, K-12, higher ed, and really so that we're kind of your top priority within that 1B group. We know that there's been quite a bit of variation. We have some places where shots are going into arms of childcare educators. We have other places where people have logged on and put in their name, and it's been crickets, like they haven't heard a thing. And a lot of it has to do with how a lot of this goes through our local health districts, right? Like for the health and hospitals, we could sort of send it through health and hospitals because they're used to giving out shots. But for the general population, for all of our essential workers that are not healthcare affiliated, the vast majority of that is flowing through our local health districts. And we know, again, different leadership, different contexts. So the governor has come out this week and last week really trying to increase the pace in Virginia, really making sure that we're not wasting any amounts. We have made a lot of progress in the last 2 weeks. I know that we did hear advocacy from Head Start, from childcare, from others, because they were feeling like they were, not getting the priority or not hearing about. But we are now up in the top 10 in the country in terms of at least the percentage of our populations that gotten a first dose. And we are kind of now over about 27,000 dose sort of shots per day. So again, and our goal initially was 25,000. So we're trying to get more and more and more out there, and kind of moving from the bottom of the pack now to sort of the top 10 in the country, across the state. Somebody said this yesterday, and I thought this was really interesting. We've now given out more doses, and there's a tracker on the VDH site, and maybe I'll ask Becca to find it and put it in the chat section. But basically we've given out more doses of vaccine than we've actually had COVID cases. So I think we've had about 480,000 COVID cases, and we've already given out over 500 and some thousand vaccines. So I know it doesn't feel good if you haven't heard in your community or your staff haven't, but, please note that, they're really trying to kind of increase this, and you can watch the day-by-day data here on the Department of Health site. We ask for your help. I know, Yesenia, we heard from Annette this week. I know that we've heard from others. There's still some concern, right? I mean, I think particularly the results are really good for the Pfizer and the Moderna, which are the two that are out there now. We are not hearing, and there's not a lot of evidence of like terrible side effects or other problems. Still, right, it's a shot in your body, and we know that folks have different feelings about that, and sort of there's still concern. So we know that Head Start, you guys are going to be key partners, both in terms of working with your own employees to get the vaccine, but also in talking with families, talking with older adults. Many of you are part of CAPS, right, who sort of work with older adults and helping folks feel more comfortable. It's one thing to kind of trust the media, but if somebody locally who you trust gets it, then you're much more likely, I think, to kind of get it. So please note that this is a top priority for the governor and for the First Lady. The First Lady heard from a set of stakeholders earlier this week about how concerned they were about making sure that childcare is a priority, recognizing that many of our programs have been open here and there over the course of the last 10 months. And then again, that families served by childcare as well as families served by Head Start are some of our most vulnerable families and kids in the Commonwealth, and really thinking through how we can work with partners to make sure that people can trust and can have access to this vaccine. Let me pause there. Are there questions about the vaccines coming out?
Hi, Jenna. Good morning. This is Patrina. How are you?
Hi, Patrina. How are you?
I'm doing well, doing well. Jenna, one of the things that is concerning to me is because of COVID, we know that the disparity that was shown, that more African Americans were dying from COVID, et cetera. I'm wondering, is there any intentionality in ensuring that African Americans are getting the vaccine at a higher rate? But because I know for myself, I am trying to get in touch with our health department director. I have a relationship with him if I can never get him on the phone, but I know the school system has 200 already vaccines. They're getting ready to vaccinate their people, and I'm still waiting to hear. And know that my staff is predominantly African American. I would think they would have reached out to us early on. Well, they did, and they wanted us to educate people about getting it. Okay, now they're ready to get it, and there's nothing to get.
No, Patrina, I appreciate that. So, yes, that same site that Becca sent around does also track by demographics and by gender. I will say right now, it looks disproportionately white. I'll just be candid. I mean, I was actually looking at it last night and talking with my husband about this. I think a part of that has to do with the workforces, right? It also, it's like, if you look at the 600,000 doses that went out, this again is as of last night, 400,000 were women, 200,000 were men, right? And so there's something weird in terms of like, not weird, but just the current data is affected by the kind of who's been eligible, right? I think that the sort of the healthcare workforce is probably, when you think about all of it's probably sort of disproportionately female. So folks are watching it and paying attention to that, Patrina. I think we are hearing that very issue, though, is that people keep reporting to us that it just feels like even though childcare and schools are in the same level, right, and should be getting served at the same time, it somehow keeps feeling that schools are getting to the front of the line. And we're trying to tackle that in two ways. I mean, one is working through the Virginia Department of Health to get back out to the health districts. We have shared with them all of the kind of contact information for the licensed centers, right? I mean, it sounds like they've clearly been in touch with you, right? And then I think we are doubling down and thinking about what we need to do to make sure that you are a priority. What we have heard anecdotally is, right, is this, the school systems have a little bit more power locally, right? And I know that we've heard everything from, kind of, sort of it's gotten involved in some of these school political battles about reopening. We've heard there's been kind of a desire to do kind of, press conferences and all of that. And so it certainly, that has been a frustration and something that we have been tackling this week with the local health departments. I'm thinking about, we were on a call earlier about whether we need to sort of send out some kind of guidance to strengthen the impetus for them to reach out to you, right, and to follow through, because you have done that work around preparing your staff and and making sure that they're kind of open to getting it. And it really was the intent. I mean, and even the way it's listed is sort of childcare, K-12, whatever else, was to make sure that you all were a priority. And we're now hearing that that is not actually happening in practice. And so we're trying to kind of to tackle that, but please note, right, that it was really intended to be kind of at the same time. The other thing I will say is, we are seeing supply issues across the board, and this is happening for sort of schools. This is happening for older adults. In the last 48 hours, I've seen at least 3 incidents where, from a huge long-term care facility, right, to a pretty significant sort of size school district where folks thought they were going to get a certain amount, and then like literally they open the truck and there's like nothing there. And so the everybody's also dealing with that too. The Gov is aware of this and is tackling that. But if you hear kind of like a horror story where or if you have a scenario where somebody was supposed to get an appointment, they show up and they're told you got to come back in 3 days, that is happening everywhere. I know it doesn't make anybody feel any better, but it's just the amount that Virginia thought it was getting from the feds was lower than expected, largely because the federal system wasn't as strong as it could have been. And so trying to kind of aggressively handle that. Another thing that we did was that, Walgreens and CVS got a lot of doses to do long-term care facilities. They weren't using them fast enough. And so the state just this week took back some of their doses and are now distributing them through health clinics. So really trying to kind of adjust in real time as they come available. But we are pushing and really sort of saying, and we will remind health districts again this week, you need to go in the order, right? You need to go police, fire, childcare, educator, and you shouldn't be getting to the kind of other essential workers until you've really addressed all of the child care and educators. So we will, we will continue to push on that and encourage you to continue to advocate locally, because unfortunately that is where most of those decisions are being made. Last point, Patrina, is we did emphasize what you just said, from an equity perspective, really important to include childcare, family day homes, other folks who support childcare, right? You go from our teaching workforce, which is 80 to 85% white, to our family day home workforce, which is 60 to 70% women of color, right? And so really making sure the family day home, childcare, Head Start, right, that they were in that same priority backup. It took some work. I will say not all states have done that, but we at least got that. We got it into the right policy. Now it's the practice, and we're committed to following through to address, right, because you have to be intentional and you have to implement, right? So we've got the intentionality, but we have not quite checked the box on implementation, and we are monitoring that very closely. And we've gone all the way. I had a conversation with the First Lady on Wednesday about this. So really saying we're going to need her help to use her bully pulpit to make sure that you guys are a priority. Great question.
Thank you, Jenna. So for those of you, check the chat. Rebecca Ulrich did put in the link to the coronavirus vaccine dashboard. So you can check that out and see how many doses have been administered in the state of Virginia. There's also a question from Robin Boyd regarding a timeline for when the system will take place in the VAMS in Virginia. Will it be up and running? Robin, would you like to elaborate on your question?
Robin, you're on mute, I think, if you're talking, just in case.
Says she has no audio. She put that in the chat.
Okay, she just put that in. Yeah, she has no audio.
I think I know what she's referring to. If you would like me to help you out, Robin. The VAM system, the state switched the system that we were going through to register for the vaccine from VAMS, and it's going to MedPod, I think, or something like that.
Yep.
And so she's wondering when that might open up so that people can. It was our assumption, I'm thinking, that whoever was in VAMS would be migrated into this new system, but there are people who were registering or decided to get the vaccine after VAMS went down. So I think Robin's wondering when that, if there's a time frame of when that new system may open up so that we can register people again for the vaccine.
Yeah, I have heard different things in different places. So thank you, Cindy, for the clarifying. Let me loop back with David Carey, who's our kind of connection at the Gov's office on this, to kind of confirm, and then I'll have Tondo send that out. But I know I've heard it's open in some places, so let me just kind of confirm, the extent to which, one, sort of where it's going to be open everywhere, and two, how they're handling kind of moving the data from one system to the other. Great question. Thank you, Robin. So the last thing I just wanted to share with folks is we have a lot of work going forward, and obviously you will have an incredible representative in terms of Tondwa and her being a part of all of our meetings virtually now at the state level. We're really excited that we are standing up a new early childhood advisory committee to the Board of Education. So this is a pretty big deal. The Board of Education, for most of its existence, has been focused on K-12, right? And then we elbowed in there and said you need to pay attention to pre-K too. But really, with this law being passed last year, the board should be thinking about birth to 12th grade, right? How do we provide every child, from infancy onward, the opportunity to fulfill their potential? That's a really big ask. But again, I think a lot of it philosophically and even spiritually kind of comes from what you all have been doing for years, right? Is that you have sort of said that, we've got to give every kid, and Head Start at its core was an opportunity program, right? About sort of supporting kids that were, may not have access to all of the resources of other kids and families, and figuring out how you level the playing field. As part of that, we took to the board yesterday 2 things: our early learning development standards, which are really close to being done. We have done a crosswalk with Head Start, so don't worry. None of these will put you in any crosshairs with the early learning framework. And we'll kind of be rolling those out later this year. But equally important, we got their approval for this new early childhood advisory committee. I believe it's just over like 22, 23 members, 22, I think. And it is a broadly representative group. So really making sure we have an advisory committee to the board that fully represents the diversity and the amazingness of the early childhood sector in Virginia. We put out applications. Becca ran this process in early November. I know we reached out to you. We reached out to kind of everybody and their mother. And we actually received over 160 applications. So it was pretty freaking competitive, which we thought was really good. It made it hard for us to sort of go through our process and identify, but it was so exciting. And our board director yesterday noted that she's never seen this type of excitement for an advisory committee to the board. So it was just tells you how passionate our sector is. But we did use their rubric. We had 4 reviewers at the Department of Education. They reviewed all of those applications. People put the most thoughtful things about what brought them to this work, why they're passionate about this work. So it was like, some of these applications brought us to tears. But after a painstaking process, we were able to recommend the members who were approved yesterday. And I think we have 3 kind of Head Start representatives. We've got Shaiki Franklin, who I see on the phone. We've got Angela Rouse, and we've got Charisse Rosario, who is Head Start in the school. So really excited that we have not 1, not 2, but 3 Head Start representatives. I will tell you, we had a lot more apply. And so, you'll get sort of formal notice from us next week if you didn't make it this round, and we hope you'll apply in the future. But I am just very pleased to know that you will be so well represented. this committee we will kick off really in about a month's time. And basically the idea is for any policy, whether that has to do with the measurement and improvement system, licensing, anything we would take to the board, we would take to this group in advance, right? So that we could, by the time we get to the board, and you'll all be able to, everybody can always kind of attend the board sessions and there's a public comment section, but it just means that we will be able to really make sure that the diversity of our sector has had the opportunity to think through the policy changes, what it means for Head Start and early Head Start, maybe flag for us some unintended consequences we didn't think of, right? So we did something similar in Louisiana. I will say that the sort of, maybe if the board meetings were 2 hours, right, that the early childhood advisory meetings were like 6 hours, right? Because we really got into it. But it just is a way, and the reason I wanted to share this with you all today is a way to really make sure that the interests of Head Start, of your educators, of your kids and your families, will be heard and will be able to shape policy. And so that's why we kind of take this so seriously as we sort of stand up this group in the next year. And again, Tondwa will be part of the team who's helping prepare the kind of content for this. We'll stay in very close touch with Dawn as well and her role, right? So, but we wanted to make sure we had sort of 3 practitioners in the field who do this work every day, shaping the policy and practice before it goes to the board. I'm really excited about that. Excellent. Okay.
Well, Jenna, I just wanted to just acknowledge and just say congratulations. Shaki is on the call. Thank you. Congratulations, Shaki. I do know that Angela Rouse and Sharice Rosario are not on the call with us right now, but we're very grateful that we have some strong, positive representation on the new advisory council.
Yeah. The other piece too, and I want to sort of going back to sort of Katrina's point about intentionality, we are really excited. This is an advisory committee that is roughly 50% folks of color, which is really important. We wanted to make sure we had folks who represent the diversity of the kids that we're serving now. We have folks, right, who are familiar and expert in working with kids who come, from homes where English is not the sort of first language spoken. We have folks who are expert in supporting kids with developmental delays and special needs. We have folks, I mapped it out, guys, we have somebody from Norton and somebody from Northampton. So literally 500 miles apart, right? Not to mention Nova. So like we literally cover the entirety of the state, which again was just trying to be very intentional about, sort of representation. And I think, particularly as we know with our current Madam Vice President, that representation matters, and we tried to be very intentional about that. And so again, huge thanks to everybody who applied. Huge thanks to the folks who will take on and add some more meetings to their schedule, because Lord knows we all love meetings. But in all seriousness, really glad to have such a representative body that will make sure that if we sort of put policy forward, that it truly reflects the diversity of our sector.
And that's that's a really good segue into just a quick transition update, because this advisory committee is going to be so integral to informing all of the work that we're doing kind of post 7-1, post transition, to really unify our broad range of early childhood programs and providers under the DOE. So I know we've spoken about the transition on this call before, but just to give kind of a really, really brief set of background for anyone who hasn't heard this before. So all of the childcare and early education programs are moving from DSS to DOE effective 7-1. So that means that DOE will be responsible for overseeing and implementing the kind of broad range of supports and services that are available to children, ages 0 to 5, not yet in kindergarten. And so we are really excited that Tondwa has already joined our team. She was kind of part of the first phase of the transition, where the Head Start Collab office, as well as the team of folks that oversee and administer all of the quality and professional development supports that are available to early childhood educators in the state. Came over effective last July. And then this coming July, we will be transitioning our licensing team from DSS over to DOE. So all 100 or so staff that are in kind of the administrative positions related to childcare licensing, as well as all of the folks that are in the field doing inspections and helping to support folks to maintain health and safety compliance in their centers or their family day homes. So all of those folks will move over just ahead of July 1, and then all of the licensing regulations, the rules that govern, what it takes to be licensed, will also move over and become DOE regulations after July 1. Something that's super, super important to keep in mind for those of you that are operating in a community-based program, none of the rules are going to change right away. So, and I know you all meet very high standards as Head Start providers, but I know we've gotten lots of questions about what's going to be different. People are really worried about having to suddenly meet new requirements, and there will be no new requirements on July 1. Everything's going to move over as is. So the really, we can't promise that if you have a licensing inspector that it'll necessarily be the same person, but it will be a licensing inspector who will be looking for the same things that they have been, supporting you through the same, rules and regulations immediately after July 1 as they have been in the past. They'll just be DOE employees. The other thing that will move over to DOE on July 1 is the child care subsidy program. So DOE will oversee that program, will hold the federal child care and development block grant, and be responsible for how those funds are spent and how we set priority for policy for the program. But DSS will continue to actually administer the program. So any families that you have in your programs that might receive wraparound care through the subsidy program, those families would still continue to work with their local Department of Social Services in order to access and be recertified for child care subsidies. So in terms of how families access care, very little will change in terms of the process. And then similarly to licensing, all the rules are going to move over exactly as they are. And then following July 1, the DOE team, me, Jenna, Tandua, and other members of our team are really going to take a comprehensive look at all of the policies, our licensing rules, our subsidy rules, eligibility for all of the programs, and really think about how we can start to move in a direction where these programs are all working together, again, under this unified system. And so, we'll be bringing proposed changes first to this advisory committee, and that's why I say they're so important to this transition work. We'll first be bringing our proposals to the advisory committee. We'll be getting their feedback. Like Jenna said, they'll be helping us really think through what are the implications of the kind of different proposals that we're considering for different provider types. Are we really ensuring that all of these policies are putting equity front and center? Are we making sure that they are putting inclusion for kids with special needs front and center? And then we will, based on the committee's feedback, take those recommendations to the Board of Education for their approval. And so, this will be an ongoing process and something that will be implemented over time. But kind of the really key message that we want to make sure folks know is that there isn't going to be a sudden switch flipped where, all of a sudden the rules change on you just because DOE now has oversight of these programs on July 1. So we are still in the process of, finalizing all of our agreements with DSS, but we are, we've been working really closely with them over the course of the last almost year due to the pandemic. And so it's really situated us to, in the worst way, or under the kind of the worst circumstances, but has really positioned us to work well together to make sure that this transition is minimally disrupted for all of you, as well as for all of the families that you serve. That is our absolute number one priority, is that, folks feel the minimum amount of disruption moving from DSS oversight to DOE oversight. Let me pause there and just see if anyone has any questions about kind of the process or our plans looking ahead after the transition takes place.
This is Dawn Miller.
Hi, Dawn.
Hi, I really like what I heard about after the first, that all of the players on the DOE team are going to look at everything in combination. I think that is so great, especially when I heard talking about eligibility, because when you have VPI and Head Start, the eligibility doesn't always match, and it's different. I think that's just great. And we spend a lot of hours on trying to do single point of entry, which we definitely think is the best way to go. But I really like how you said you're going to talk about everything and pull everything together. That makes me really happy today to hear that kind of information, because it's really needed. And so thank you. Just thank you for taking down that path and getting ready to really help us in that. I'm hugely happy to hear all of that. Thank you.
Absolutely. Yeah. I mean, again, the whole idea of having all of these programs under the DOE is really so that we have this single point of accountability for school readiness, right? We want all kids to have the best quality education, best quality supports and services available to them, kind of regardless of what setting they're being served in. And so really making sure that all of the different programs are, again, working together, working in concert, that there's no conflict, is super, super important to us. And that really is the point of this unified system, bringing everybody together under the same roof and making sure that things are working in coordination. Jenna, anything else that you would add in terms of an update on the transition?
I don't think so. I mean, I think the key thing, and we probably will just work with Tondra to kind of come back to this group post General Assembly session, and as we get closer to the transition, hearing Don's point, it does remind me, as we think about enrollment for next year, right, that we are certainly emphasizing that it's going to take more collaboration than ever. And one of the things, thanks to some of the information I know that Tondra has been sharing with us about who's open, I think we're going to probably ask for your help on sort of tracking, where you are in terms of virtual or in person, potentially tracking your access to vaccines, right, so that we can share that information across sort of state government in order to kind of get better support you. We are sharing right now pretty broadly that we have seen, huge drops in preschool enrollment. And so kind of across the board, you've probably read in the paper that, kids have opted out of public school. But what you don't often see is that the greatest point at which they're doing that is pre-K and K. Thousands more. We have about 12,000 kindergartners. I say missing, people sort of disagree with me, but I arguably think they're missing. About 18,000 preschoolers, and that includes both things. This is in the schools alone. So this is predominantly VPI and early childhood special education, which is way more than you see, missing at third grade or eighth grade or whatever else. And while we see more white affluent families opting out of kindergarten, we see more Black and Hispanic families missing from pre-K. And so that is just sort of really kind of disconcerting to us. And I say this for two reasons. One is I think we're going to really want to coordinate closely on enrollment for next year. And we're even looking now at how we make sure to provide maximum flexibility. We think there might be kids out there who might be age eligible for kindergarten, but might, if they didn't do any preschool, for instance, it might make more sense if the family wants it and it makes sense for the school division, for instance, to have them do VPI, right? Again, think of a kid who was, potentially born in sort of September, right? So it was going to be the youngest in his group anyways, didn't do preschool next year, making sure, and again, this is a division and a family level decision, right? We're not going to mandate anything from the state, but providing kind of more flexibility there. I also think that it's just going to take some time to rebuild trust, right? I mean, when we look at who's missing, when we look at, and even, and this is even with sort of virtual often, we've also heard from you, right, that enrollment is down. I think luckily the feds, similar to, sort of others, are holding folks harmless. But, we are, we're just missing kids, right? And I think it's a little bit about fear and safety. And so we've got to get these vaccines out, and we've got to kind of make sure folks understand that we can do this safely. I also think it's also the stressors that our families are serving, right? So, I mean, like obviously virtual Head Start or virtual pre-K is safe enough. And what we're just hearing is that these are families that are like in crisis. And the idea of trying to get a kid to kind of log on or to do this it just feels like too much, right? And we hear that, right? And we sort of see that as, I see that as a little bit of a cry for help in and of itself, right? In terms of the challenges being faced by these communities. So we look forward to kind of continuing this conversation and this partnership as we kind of come back next year, right? And I don't think any of us, after 11 months of us, think it's going to be like a light switch, right? And like all of a sudden everybody's going to show back up on August 1st or July 1st or September 1st, right? Like I think it's going to take some rebuilding of trust. I think families are going to need to feel like it's safe, right? To come back. And I think that's going to be true for both, I imagine, for Head Start as well as for VPI, and all of the work that we have collectively done to illustrate to our parents and our pastors and our communities, right, that preschool is important. I feel like we're going to be having those conversations again, right? Or you're going to need to be having those conversations again in order to get our enrollment across the board back up. So that, I know that wasn't exactly related to transition, but as I heard the question about enrollment, just wanted to kind of share that what you all are seeing, we're also seeing in other preschool programs in both the private and public sector. And I don't want, and I say this us as I sort of say this not to be condescending, but I think we have to, you all know better than anybody because of your incredible family engagement. I think we have to recognize that rebuilding trust and sort of is going to have to be one of the first things, and reminding people how important preschool is going to be just such important work in the upcoming year.
And one quick thing I would add to that, and no, we're coming up on time, is just I think we want to make sure that we're acknowledging that we're doing all of this transition work in the midst of a pandemic, right? That doesn't have a clear end in sight, and so we are, doing our best and really thinking about this as an opportunity to, you all know this from your work on the ground, as well as have probably heard us say it many times, that the pandemic has really only revealed cracks and inequities that have existed in the system for a long time. And so while this is not a situation any of us ever imagined us being in, would never want to be in, we are trying to use it as an opportunity, given the timing of the transition, to really build in what was or repair and from the kind of ground up, address those inequities, address those pieces that were kind of fragile or not solid from the beginning as we're thinking about this unified system. So just want to acknowledge that that is very much informing all of our thinking and all of our planning as we are kind of looking ahead to the future and really, as Jen has been saying lately, building back better than we were before.
I would like to say thank you, Jenna and Rebecca. We know that we have a great foundation, and it's going to take us a lot of work to get to where we have a more unified system and more coordinated efforts. And thank you, Dawn Miller, for your sentiment. We are excited that we're going to take a more focused look on all of the components to make sure that the decisions that we're making will serve the children and families better across the entire state of Virginia. So thank you for your sentiment, and we all feel the same way. Any further questions? Anyone have any specifics before Jenna and Rebecca have to jump off?
I just want to reiterate that we're thankful for your support and the collaboration, and that everything is working together for the greater good of our children and our families. And thank you for coming on today as well. I think it's helpful if we have another update in like another couple of months or something. Thanks.
Yeah, so we know that they will have to come back and revisit us and share any updates. And, you know, we want to keep you in the loop so that you know everything that's transpiring through DOE. We're trying to be as transparent as possible. So, you know, send your questions. Dawn and I will make sure that they get to the appropriate people. It is 10:58. I know that Jenna and Rebecca have a chock full day of meetings. Thank you so much for joining us. See you next time.
Thanks for having us.
Great. Everyone else, if you could give us a second or two, I just want to make sure that everyone's doing okay. Make sure you check the links of resources that were shared on the agenda. That would be extremely helpful. I think it's some pertinent information that you need to have. But really quickly, I will be sending out another link for the Google Doc, just for us to update our enrollment numbers now so that we can keep on top of how everyone is doing. I also have to share those enrollment numbers with DSS so that we can get out the pandemic EBTs. I just want to make sure I have accurate numbers. I don't want to give them any inaccuracies. We want to get those out as soon as possible because it's already taking a long time for them to compile this information as it is. I just really quickly, I know that Michelle Carrington shared a question about any food service vendors. Does anybody have any recommendations for any food service vendors who prepare and deliver meals to your programs? If anybody has any information, you can throw it in the chat and that will go out with the recording link, and we'll make sure it gets to Michelle to help and support her. I know that you knew, I sent some links to you. I know that it's not that easy under the circumstances. I see you shaking your head. So if anybody has any resources or supports for her, that would be helpful so that we can all pitch in. Yes, Dawn.
I know we're trying to rush, but I really want to say something to bring it to life. I'm going to be sending an email out later today with a link to vaccination education webinar that would be amazing for you to show your staff if there's a lot of reluctance. I wish Shirley Wells was on the line. She said last week over 50 staff, only 8 went for the vaccination. And this was made from Region 9 and Michigan Head Start Association, my colleagues this week, and it is amazing. There's 3 parts to it. That just brings about 1, how the vaccine was created and the timeline and the trials and the scientific part. Then 2, they have a brain development person on there talking about people responding out of fear or out of facts, and how, you know, your downstairs brain and your upstairs brain, and trying to be logical. And then there was an African-American man who is a Head Start director in California who talked about his personal experience with his concerns about it and the education that he received, in a very poignant video embedded in this webinar. I think it's the best webinar I have seen since COVID started. I don't really talk things up that much like this, but it's very worth your time. So if you could take a look at it and think about showing it to your staff, I think you'll be really pleased. Thanks.
Thank you for that, Dawn. I know that the initial ask was about the General Assembly updates, but I think that Jenna and Rebecca really illustrate all that is going on through the Office of Early Childhood. And as things progress and as we get more information and updates, I will share that information with you as well. Did anyone else have any specific questions, or did they have anything that they needed to share at this time?
Good morning, everyone. I just wanted to just shed a little bit more light on my question about the food vendors. Our program is located in Caroline County, which is kind of between Richmond and Fredericksburg. And we currently operate within the public school system in the county, but we are preparing, we're going through the facilities process right now because we are preparing to move to our own site. So we do not want to actually have to prepare meals on site. I'm looking for a vendor that will be able to deliver the prepared meals to us, and where we'll have a warming kitchen before we distribute meals. So I asked the question before, and I got a couple responses back, but the companies that I previously had information on were kind of too far from where we are. I think the closest one that I was able to speak to someone from was Fredericksburg, but that still is a bit of a distance for meal delivery on a daily basis. So I am trying to find out if there are any other vendors or if any programs that are standalone, you know, have a vendor or anything similar to what I'm describing that you all could share.
I have one suggestion that might be out of the box thinking, but if you've checked with any local hotels for their caterers or event planners, that might be certified FDA, because that would be local to you. I know when we plan conferences, some of the hotels ask us to work with a caterer, and we've had to get proposals from them, and they might look at this as another source of income right now because they're probably not doing events for hotels. So I would check there if you're at a standstill.
Thank you. I'll do that.
Also, Michelle, I don't know if your school system would entertain this, but in my previous program, we were off-site, and the school system still provided the meals for us, but we just had to transport them. So that might be an option as well if you're still in close proximity of the school division and they're willing to do that. There might be a source of in-kind, not that I'm sure.
We will be in proximity to the school, but that is I'm not really sure how willing the school will be at this point. We are, you know, preparing to ask for certain partnerships with the school, but right now I'm not sure that how willing they would be to doing that because they don't really want us to move.
You might also check with your local hospitals and nursing homes in the area and see if they are doing food services outside.
That's a great suggestion too. Mm-hmm. They'd be more familiar with the USDA as well.
Mm-hmm.
Okay.
Just the ACFP, excuse me.
So thank you so much for those who shared. I think you have some people to follow up with, Michelle, and just keep me in the loop, Dawn and I, and let us know if you need any further resources or suggestions as it pertains to any food service vendors, okay?
Okay.
I just wanted to say really quickly, thank you all. I needed y'all last week. Thank y'all.
And we're so glad that you were able to come back and join us again, Katrina. And that's what the meetings are for, so that you do have time where we'll have our content specialists. We're going to get some specific information and updates and resources. And we do want to make sure that you do have some space in between for if you just really want to just let it go and share what you're updated, how are you doing, and is anybody else having some of the same issues? So that's why Dawn and I decided to have 1 week where it's more formal and the other week where it's informal, so that you always have a space for that. So Thank you for coming back, Katrina. Well, it's 11:07. Thank you so much for your time. I appreciate you joining us today. I hope that you found it very helpful. If you have any further questions, please feel free to reach out to Dawn and myself, and we'll follow up with you to get any answers that you need or point you in the right direction. We will be together next week, and next week will be informal. So we'll just be checking in to see how everyone's doing and to check your status. I hope you have a fabulous Friday. Enjoy your weekend, and we will see you next time. Take care.